to the Great Lakes Fittest podcast. My name is Josh. I am the co-director of Great Lakes Fittest competition here in Traverse City, Michigan. It's going to be happening very soon, September 14th, 2024 at Turtle Creek Stadium. Super excited to host it again. We have some great people involved, some great sponsors, and one of those sponsors is my guest today, and his name is Mario Palomino. He is the owner of Palomino Physical Therapy and Performance. Mario, thanks so much for coming on the podcast today.
Most definitely, Josh. Thanks for having me. Was there last year. Super excited to do it again this year.
Yeah,
I know
man.
it's gonna be bigger, better, more people, more attractions. So we're ready to go, man. We're gonna have some newer things too, and yeah, we're
Awesome.
pumped.
Awesome. Yeah. We're going to get into all that like as we get through our conversation here, but Mario is also a member of CrossFit Due North, which is the gym that me and Brad own. Brad is the other director of Great Lakes Fittest, and Mario is a wealth of knowledge when it comes to rehabilitation, injury prevention, and just kind of working through all those like kinks that we get when we're lifting weights. It's not necessarily CrossFit even, it's just like lifting weights in general and being physically active. So we're very fortunate to have a member of the gym like Mario that can kind of like say, "Oh, is that bothering you? Like, let's try this." And he works with people through all sorts of different things. So yeah, very happy to have him as a member of the gym and as a sponsor at this year's Great Lakes Fittest. So thanks, man. We really appreciate it.
Yeah, most definitely. I appreciate it.
Yeah. So today, what we're going to talk about is what you're going to be doing at Great Lakes Fittest. But before we get there, I want to talk a little bit about how Palomino Physical Therapy and Performance kind of came to be. We can let the people know.
All right, sure thing.
Yeah.
My story, Josh, is not very traditional. I tend to take the long road and the windy way to get to my conclusion or where I'm trying to end up, and
Sure.
it was no different with my career. So Um, I did know, however, in high school that I wanted to be a physical therapist. I was exposed early. I had an injury myself. I had a stress fracture in my foot. I was a cross
Got it.
country and track runner. So I was trying to get, to compete at the college level. This was my junior year. So I went through
Oh,
PT.
wow.
Yeah, I went through PT. It was a okay experience, not the greatest. But the one thing I definitely noticed was that the PTs enjoy their job. You know what I mean? They,
Mhm.
they really liked what they were doing. They were having fun. People were getting better at the end of the day, whether they enjoyed what they were doing at the moment or not.
Sure. Yeah. Yeah.
But I mean, it was just an easy call right away. And then that was reaffirmed later the following year. My grandmother had a stroke, and I got to see a PT work with her at her house. So that was a
Wow.
good experience in itself. And my grandmother absolutely loved this PT, worshipped, the ground that he walked on, thought he was a
Yeah.
hero. And again, that kind of being a hero from time to time is a good feeling. So
Sure.
that
Yeah.
was that was the
Absolutely.
draw, man. That was the draw. Now, if I fast forward, and it is a lot of fast forwarding because again, it was not a straight path. Um, but like I said, 18, I knew I wanted to be a PT, so I went to school, came up to Michigan, did my undergrad. I ran cross country and track. That's where I met Leah, actually my wife, who also
Yeah. I
works with me.
was gonna say
Um,
co-owner, right?
Co-owner, correct?
Co-owner.
Yes,
We
very
don't. We
clear
can't.
about that.
Yep. Yep. We can't. Hey, we can't skip over that. That's for sure.
Oh,
That's good. Very
in
cool.
a lot of ways, she's my boss, even. So,
Yeah.
co-owner, maybe
I
that's
can
like me
relate.
underneath her to a
I
degree.
can relate. So
Yeah,
what,
I get it.
where was that at?
I'm sorry, what school?
Yeah, what school did you go to in
Oakland
Michigan? And
University.
Oakland. Okay,
Oakland
cool.
University.
Right on.
Yep, downstate. So we
Yeah.
both ran cross country and track there. Um, and man, you go through collegiate athletics, and I want to say this is normal, but I might be generalizing too much. When I was done, I was done. I was burnt out. I
Mhm.
was tired. Didn't want to run. My focus was on PT and working. Um, so I started lifting, thinking, "Hey, this will be good, right? Put some
Sure.
weight on." I was 125 pounds when I was running, so I wanted to gain some
Wow.
weight, be
Yeah,
strong,
yeah, yeah, yeah.
you know. Um, but there was still that competitive edge, that
Yeah.
reason to work out. That's what cross
Yeah.
country was. I'm working out so I can compete and beat you
Right.
guys, right?
Right. Yeah, yeah, totally.
When you're in the gym by yourself, it's not the same. I'm not competing with anyone around me. I'm doing it for
Yeah.
health. I want to look a certain way and feel a certain way.
Sure.
But personally, for me, it was just not enough. I needed more motivation. So again, fast forwarding here, I'm in
Yeah.
PTA school at this point, and I meet a guy who's also in this program with me who does CrossFit.
Mm.
Josh, someone asked me the other day how long I've been doing CrossFit, and I usually just say a while because I don't know. I haven't thought about it, but I knew
Yeah,
coming on this podcast, that was something I should know.
I was gonna ask you that, yeah.
12 years, brother. It's been 12 years that I've been
Oh,
doing CrossFit
man.
on and off. But it started with this guy that I met in this physical therapy program. And he's like, why don't you just come try it out? He didn't sell it. He didn't tell me it was great, bad, just come check it out.
Right.
And, I think a lot of at least traditional CrossFitters, they were hooked after the first one.
Yeah.
Um, Definitely was not hooked after the first one. I think the week I went every day that week and I got my butt
Oh.
kicked. It was very humbling.
Oh,
Um,
man.
and that last, I want to say Thursday or Friday, whatever it was, they did Fran. This is my first week.
Oh,
And
Lord.
I've got an ego like everyone else. I'm this collegiate athlete. I'm going to come in here and knock the
Sure.
socks
Yeah,
off of
yeah,
everybody.
yeah.
No, man, it was CrossFit, right? It kicked my ass. Everyone got to see it kick
Dude,
my ass. I was hurling in the
dude.
corner. That's when I was hooked, though, man, because everyone knew how I felt. Everyone was looking at this
Yeah,
guy like, oh, yeah,
sure.
I've been there. You know what I mean?
Yeah, yeah,
And
totally.
the community kind of lifts you up after that. And then obviously everything else that comes with CrossFit. You see
For sure.
results, you get better. But that was my long, long, long but
Dude,
condensed story of how CrossFit and Palomino physical therapy came together.
got it.
So I'm exposed to CrossFit. I'm doing
Mhm.
physical therapy. I've graduated from school, and any CrossFitter that I've ever had, and I worked at a more traditional PT place where you have a lot of therapists around, a lot of clinicians, a lot of support staff.
Mhm.
Um, any high level athlete or CrossFitter was being told to stop.
Yeah.
Your back hurts. I probably shouldn't do CrossFit anymore.
Yeah, 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 yeah.
And
Boy,
that's
I mean, we've heard that from I've been before you came around, like, I've had back injuries. I know Brad has as well, multiple people, like, and that is the general consensus is that whatever you however you did this, it's off limits. You can't do it anymore. It's just stop. So that rings. I'm sure that whoever's listening to this, if they're in CrossFit or in sport or lifting, they've heard the same thing at some point. Like, that's so true. Yeah.
and I mean, not only is that frustrating, but I mean, what are you supposed to do with that? I
Yeah.
mean, even as a clinician, I don't know how I'm supposed to help you get back to your sport if I just tell you to stop it. Now, there's
Right.
adaptations, modifications, all that jazz. But at the end of the day, that was definitely something needs to change here.
Yeah.
Um, and then that kind of even makes me go off on a tangent, healthcare in general, and physical therapists. You know what I mean?
Yeah.
You've seen me in the gym. I have my own set of injuries. It's not like I am privy to any of that just because of the knowledge I have. I get hurt
Right.
too. And what I
Right.
like to remind people is CrossFit guarantees you to get past where you're at in your life.
Mhm.
I mean, in all so many realms, man, not just physical, but let's stick with that. If you do CrossFit regularly, you will get faster, you will get stronger. Yeah, I mean, it's going to happen.
Yeah.
Um, with that being said, as a physical therapist, I think CrossFit, especially done right, the way Due North does it, you and your coaches, it's the best rehab there is.
Mm.
And I think it's that simple. Don't stay away from it. Learn to adapt within it and get stronger within those deficits, that you
Yeah.
might have. But stopping it altogether, oh, that's the worst. Sorry,
Yeah,
I could
man.
talk about that forever.
No, no, that's good. That we could do another deep dive, podcast on that kind of stuff. But I mean, that's 100% true. And speaking from, again, I'll speak from experience and actually coming to see you too. You gave me a lot of work to do, like, on my own. And you also, like, tested out a couple movements. My injury in particular was with my back. And, you said, we're going to do a deadlift and it's going to be 135 pounds, which is a fairly lightweight, for me,
Yeah,
and
absolutely.
you said, we're going to try it out. And I said, well, I can tell you how it's going to feel. And what we did was we worked on different ranges of motion. We went from, like, blocks, so we raised it up, and we found a position to where I could still work through the movement. I'm not saying that you were like, just do it, shut up and just do it anyways, but
Yeah, right.
we worked through different ways to make it pain free. And I was like, oh, like, because I was scared, when you have an injury, you're just nervous to do it. Even though if you're like, I'm tough or whatever, I can work my way through this, you're still nervous about it. And what you did was, I never heard, well, you got to stop doing that for this amount of time, blah blah blah. But it was like, let's figure out a range of motion that works for you so that you can continue to move. And then when you're not doing that, we have these corrective exercises that we can do. And there was like this whole plan laid out.
Yeah.
And here I am. I'm pain free now. So it's like it took a while, but it was like, you can't expect something to just like, if you have
Yeah.
something like seriously wrong, it just doesn't, turn
Well,
on
and
or off
that's
like that. But there was a whole
you
plan. That's what you
you
see.
you hit on that really good point. That's another reason why I selfishly like to work with athletes and CrossFitters because you guys are motivated. You're trying to get back to something very specific, and sometimes
Yeah.
that can be a job for people, but you spend money at CrossFit, you're putting time into it. You're working on your nutrition as well. So it's a very important thing. Um, I just lost my train of thought.
That's all right. That's all right.
God,
The
you said something so good.
oh, not very many
Man.
people say that about me, so I'm gonna hang on to that, like, just, like, I'm gonna keep that close to my heart. If it pops in your head, we can jump back to it, no big deal,
Okay.
but I think
Fair
I
enough.
think that I mean, the big thing is that, your approach is much more, like, holistic and corrective, versus, like, just, like, abstaining from doing, like, a certain movement, and that's, like, what helped me kind of understand that that's okay to do, and going through months of, working out, it was like the movements were modified, but I was still able to do like the hinging motion, which is what made me nervous in the first place. Yeah, I just had to kind of alter what I was doing, but I could still do CrossFit and I could still be in there, with the class and be in there with the people that I like to see and stuff like that. So it was really helpful, and I'm sure that that's a pretty common thing, like, that you see just and well, we can take it even out of the CrossFit gym, just, like, people in general, like you said before, they wanna keep doing what they were doing, but in a healthy and efficient way, and it's, like, your job have figured out how to help people do that and recover at the same time, and that's, like you got
Yeah,
it.
that's
You did it,
that's what I like to think, man. That's the
Yeah,
plan. Yeah. And it is funny. So the way you're saying that too, that makes me think, the way I used to work in again more of the traditional sense, you're treating people for 3 hours a week for however many months, it's a script that's has to be this way.
yeah,
And maybe it's the freedom more of being a business owner. I don't know, but I don't have to do that, Josh. So again, to your
yeah,
testament, yeah, it takes time. And that again is more money. But how great is it? Like you and I could sit down, have a conversation like we are now. Here's my
mhm,
goals. Well, here's what I can do for you. I give you the interventions and I see you when I see you.
yeah,
That's the other rarity is being able to work with people who I know are going to go to the gym and do these things because again, they're motivated, they want to get better. So maybe I'm doing some dry needling or I'm doing some cupping, stretching, whatever it is I'm doing,
yeah,
manipulation. You feel a little better. All right, that's provided the window. Go deadlift. Go do what it
yeah,
is that we've talked about, whatever strategy it is.
yeah,
Um,
totally,
and again, I think if we can cut down time and money, everyone's going to be a lot happier at the end of the day and still get the results.
totally, yeah. That's
So
it, man. Like, one of the things you just dry dry needling. I had never done dry needling until I came to see you, and man, did I hate it. It sucked. It
yeah.
was stupid. I didn't like it. But, like, what and I've told people this now that I've been through it, it was like, it's the accumulation effect. Like, at first, you're just like, "This I'm good. I don't want to do this anymore." But, like, you do a few tests, range of motions tests, you do some dry needling, do the range of motion tests, so all of a sudden the range of motion is a little bit better, the pain is better, and you're like, "Okay, well, maybe there's something to it." The next time you go, a little bit more, the next time you go, a little bit more. So it's this accumulation effect of that particular method that really, really helped me, like, get behind it. I was like, "Okay, like, this might be uncomfortable." It was really uncomfortable at first, but obviously you get used to it and you're like, "Okay, this is just how it is." But the lasting effect of it was just pretty, like, unbelievable. Can you talk a little bit about I don't we don't obviously that's a method and that requires a lot of time, but, to, like, go through, like, the ins and outs of that. But can you share a little bit about, like, how you decide if a treatment is right for a particular person?
No, I like that question. Yeah, absolutely.
Thank you
Well,
so
one of
much.
the one of the things that I like to take pride on, and it's all over our website and stuff, is that it's individualized one-on-one treatment.
Yeah.
Again, that's from working at places where, I had 3 patients an hour, or I didn't have any say over who I'm treating. I might evaluate you one week, Josh, and never see you again. So
Right.
the fact that we don't have to do that gives us all this power and time to really create this really nice program for each individual patient. So that's what we do. Typically sit down, go over the problem. Let's just say, for arbitrary purposes, it's low back pain, generalized. We don't know why it
Sure.
just hurts. It's been hurting for years. So we spend that whole hour trying to diagnose, taking subjective information, objective information, but then also, which is also not typical, leaving time for treatment on day one. And typically, I will choose dry needling. It has to be safe. It has to make sense, obviously. Phobias. There's a lot of people, Josh, that are afraid of needles.
Sure.
Sometimes I'll
Totally.
go down that road if I really think it's going to be that beneficial. But if you're not into needles, that's okay. There's always another way. It's
Right.
more along the lines of really identifying properly the tissue that's involved. And sometimes it's easier than it sounds. But let's say, okay, again, low back pain, we know dry needling is going to help. So we start kind of explaining. I use a model, and I have some anatomy apps I think I've shared with you before, where it's a whole kind of like these picture shows anatomical
Yeah.
models where it's like, hey, this is where I'm going to stick the needle, and this is why we're going to do it this way. This is what you can expect. Um, I tell you what, buddy, I've practiced most of my career without dry needling, and I'm looking back thinking, damn, how did I do it? Because it just set everything up, and I'm a subscriber too. Yeah, again, doing CrossFit, I have my own aches and pains, and I do have a serious injury that hasn't bothered me in years. But if I have anything creep up, it's the best part of working with the missus as well. Hey, can you needle my back? Can you needle my shoulder?
Yeah, totally.
And that's the other thing I think you and Brad both could attest to. It works better before there's dysfunction.
Yeah.
Actually, there's a lot of members that come just every couple weeks to maybe get a part needled because that's all they need. There's not pain anymore. It just gets tight. So they're doing all what they need to in the gym to reach their goals. But then they
Right.
come in and do things I can't do, patch them up for 30 minutes with some needles. They walk out with full range, better strength recruitment. They get back to work with you guys where the rehab actually happens. So I think
Totally.
it's a beautiful thing. And actually, that's the main reason I'm happy to showcase that for the Great Lakes Fittest, because in between these workouts, before these
Mhm.
workouts, come on over. I mean, dry needling is going to be free for all the athletes.
Oh,
I
that's
can't
awesome.
do elaborate things, but if you're having low back pain, you're having hip, knee, shoulder, whatever it is, we can throw some needles in, and I think you might be surprised at how you'll feel afterwards.
Yeah, I definitely agree. And that was, I mean, it's great segue into like, yeah, what's going on like this year. Mario's gonna have a booth and a table, obviously, set up. So any competitor that is there has the ability to kind of go over and talk to him and figure out like what's going on and see what might be a good way to kind of either loosen up or, you know, get a knot
Yeah,
like ironed out, something like that. Um, the fact that dry needling is going to be available to everyone, the competitors is really, really special. And you know that he's going to do it right, and it's going to be like a really like safe and I know that they're like sterile and clean, kind of
absolutely.
a.
That is.
We're talking
It's
about
funny you
needles and
say
stuff like
that.
that. You gotta
I
talk
do. I
about
get
that.
desensitized to it, but yeah, that's a
Sure.
good point. No, each needle has a sterile tube that it comes in, and it's packaged individually from all the other needles. In fact,
Yeah.
in the box, wear gloves the entire time, and things like that. But yeah, I've
Right.
never had an issue. Knock on wood, and
Yeah.
there's not actually a lot of issue in literature about it.
God, it's
Infections
awesome.
don't really. I mean, as long as you best safe practice, that sort of
Yeah,
thing.
yeah, of course. And yeah, I mean, if those of you that are listening to this, like, you never have to worry about anything like that with Mario or in the Palomino physical therapy and performance with whether it's Tim or his wife. It's all good. We're just really excited to have him on site like for the whole day. So be sure to check him out. If you're there at Great Lakes Fittest, like definitely come to his booth, talk to him. Even if you don't have like a nagging pain or anything like that, if you've got questions about something that maybe you're not a competitor, but in a gym or in the gym, you're doing a lift and something's kind of bothering you, ask him. Like
Yeah.
he'll be able to share like some really interesting expertise and insights into like what might be going on and maybe even run you through like some drills or give you some corrective exercises to do because it's just the kind of guy Mario is.
It's what
He'll
we
help
do,
you out.
baby. And you know what? That's what I like, Josh. You said it great. Yeah, guys, no needles, cupping, whatever it is. If it's just questions, please. We're open
Yeah.
books. We love helping the community, and that's why we're going. We want to be out there and we want to be in it. So please don't
Yeah.
hesitate. Come up and ask us any questions.
Cool. Well, before we get off the podcast here, why don't you tell people just real quick where they can find you? Like
Sure.
if there's Instagram or Facebook, I have your website pulled up over here. We can take a look at that again.
Yeah,
There,
perfect.
look at that beautiful couple right there. That's Mario
Uh,
and his wife. Yes.
so yeah, that's
So,
our website,
yep.
absolutely. And even there, you could see we have our handles for Instagram and Facebook. It's at Palomino PT. And then my wife, who actually same company, but she does have a different handle because she does pelvic floor therapy as her specialty, and that's at Michigan MI Pelvic Rehab. That's hers at MI Pelvic Rehab. Sorry.
There we go. There it is right there. Excellent. Excellent. There we go.
And then
I just want
soon you'll be able to find me on location next to you guys, Josh.
That's
I'm
right.
looking forward to that, brother.
Yes, CrossFit Due North will be moving in the coming weeks, and Mario is going to be in house. He's going to have a space with us, and we're super excited about that. So maybe this Great Lakes Fittest podcast will take on a year-long kind of like evolution where we start to do more things like this that
I
aren't
like it.
necessarily directly related to the competition, but just related to fitness in general. So
Yeah, heck yeah,
I would
man.
love to do that. So, Mario, hey man, thanks so much for taking time out of your day today to be on the podcast. I really appreciate it. And yeah, man, we'll see you on September 14th, Great Lakes Fittest.
Super excited, man. Appreciate you having me. Thank you. It's gonna be a blast.
Yeah, man, awesome.